What is the significance of hepatic enzyme polymorphism in toxicology? Polymorphisms in liver enzymes, like cytochrome P450, cause individuals or breeds to metabolize toxicants differently. For instance, greyhounds metabolize barbiturates slowly due to deficient CYP enzymes, prolonging anesthesia. In cats, lack of glucuronyltransferase means they cannot detoxify drugs like acetaminophen effectively. Recognizing these genetic differences is critical for avoiding breed-specific adverse drug reactions. How does delayed gastric emptying affect toxicant absorption? Slow gastric emptying, due to opioids, pain, or disease, delays the movement of a toxicant to the small intestine, where absorption is most efficient. This can prolong the onset of symptoms. For instance, a dog ingesting enteric-coated aspirin during a pain episode may show delayed but eventually severe toxicity. Clinically, delayed emptying may allow extended time for emesis or lavage to be effective. What is the first-pass effect and how does it reduce oral bioavailability? The first-pass effect refers to the liver's ability to metabolize a compound before it reaches systemic circulation after oral absorption. Drugs like morphine or lidocaine undergo significant first-pass metabolism, reducing their oral effectiveness. In toxicology, this can make oral exposure less harmful than parenteral routes. However, liver-compromised animals may lose this filtering capacity, increasing oral bioavailability and risk. What is the role of pulmonary excretion in toxicant elimination? Volatile toxicants, like anesthetic gases or carbon monoxide, are eliminated via the lungs. This process is rapid and doesn't require metabolic conversion. For example, carbon monoxide poisoning in dogs is managed with oxygen therapy to displace CO from hemoglobin and enhance lung elimination. In wildlife exposed to industrial fumes, the lungs serve both as an entry and an exit route for toxicants. How does milk excretion affect residue risk in lactating animals? Lipophilic and low molecular weight toxicants can be secreted in milk, posing risks to nursing neonates and humans consuming dairy products. For example, organophosphate or chloramphenicol may appear in milk after treatment. Withdrawal times must be strictly followed, and drugs approved for lactating animals should be selected carefully to avoid milk residue violations and neonatal poisoning. What is the relevance of zero-order elimination in poisoning cases? In zero-order elimination, a constant amount of toxicant is removed per unit time, regardless of concentration, often due to enzyme saturation. Classic examples include ethanol and high-dose phenytoin. In veterinary cases, overdose of theobromine, from chocolate, may switch elimination kinetics, leading to unexpectedly prolonged symptoms. This requires prolonged supportive care and monitoring beyond initial signs. How does dehydration impact toxicant elimination? Dehydration reduces renal perfusion and urine output, slowing elimination of water-soluble toxicants like aminoglycosides or ethylene glycol. In such cases, plasma concentrations may rise even if the exposure dose is low. That's why IV fluids are a cornerstone of supportive care in poisoning, restoring renal flow and enhancing excretion. Dehydrated animals are also at higher risk for nephrotoxicity. What is saturation kinetics and how does it complicate dosing? When elimination mechanisms become saturated, for example, enzymes or transporters, toxicants accumulate faster than they can be cleared, shifting from first to zero-order kinetics. For instance, in high-dose phenobarbital therapy, saturation may lead to unpredictable blood levels, necessitating therapeutic drug monitoring. In poisoning, it means small dose increases can cause disproportionately higher toxicity. What are the toxicokinetic concerns with transdermal drug delivery? Transdermal delivery offers sustained absorption but raises concerns in species with a thin or permeable skin. For example, fentanyl patches in dogs or cats can cause variable absorption depending on skin thickness, temperature, or grooming. Accidental exposure, for example, licking, or altered kinetics in shaved areas may lead to overdose. Toxicokinetic modeling helps predict plasma levels based on patch size, duration, and skin condition. How can enterohepatic recycling affect treatment of toxicity? Toxicants like phenobarbital or some NSAIDs undergo enterohepatic recycling, prolonging their presence in the body. They are excreted in bile, reabsorbed in the intestines, and sent back to the liver, forming a loop. Activated charcoal, multiple doses, can interrupt this cycle by binding the re-excreted toxin in the gut. This technique is often used in prolonged theobromine or carbamate poisonings in dogs.